All right, I'm just gonna get started. Thank you so much for being here. My name is Eileen. I am the Outreach and Volunteer Coordinator here at NAMI Miami-Dade. We're so excited to have SoMypolar here with us today to talk. I'm gonna go ahead and introduce Sherrod Johnson, who is our current Black and Underserved Community Initiative Outreach Coordinator and our Deputy Director of Outreach and Communications. She is going to give a short bio on SoMypolar and as well as introduce them, and we'll get started.
Is this better? I had a beautiful speech I just said. Well, again, good evening, everyone, and welcome to NAMI's special edition of our Expert Series. And this is in celebration of Black History Month as we continue to bring awareness to all communities about mental health. I have the honor and pleasure today of introducing two fabulous speakers of SoMypolar INC. And without further ado, I would like to introduce you to Melissa and Jihan. They have started a nonprofit organization that serves the mental health community. Melissa was diagnosed with more than one mental health illness and chose to live a life more significant than what society portrays. As possible, her diagnosis was given over 10 years ago, consisting of bipolar, OCD, schizoaffective disorder. Joanna is her caregiver, a role that she was thrown into after witnessing the struggles of her childhood friend. A role unfamiliar for both, and it embarked them on their journey. It catapulted them into a movement to fight stigmas and shed light on the life of the two, showing a great example of when people love others with mental illnesses and what it can do. SoMypolar INC has hosted many discussion panels on mental health awareness and wellness, mental illness, and the vitality role of a caregiver to someone with mental illness. Both Melissa and Jihan, and excuse me if I'm mispronouncing your name,
it's Jihan, but thank you.
Garden, Florida, and represent their humble beginnings with pride. MyPolar was established in 2019 and is located in Aventura, Florida. Without further ado, SoMypolar INC.
Hi, guys.
Hi, everyone.
Hi.
Thank you so much, Sahar, and thank you to NAMI for having us here for the Ask the Experts Black History Month edition. We're very, very excited to be here with you. Thank you for everyone who's joined as well. Just like Sahar mentioned, I am diagnosed with more than one mental illness, schizoaffective disorder, bipolar 1, and OCD. I think that's important to start off the conversation because within our community, it's difficult at times to talk about mental illness. Honestly, in any community, in any creed, it's difficult. So I think that we did take this time out during the month of Black History Month, but we always keep in mind that mental health, mental illness, mental wellness is for everyone, and it will always include everyone in the conversation. So that's kind of about a little bit about me. Jihan.
Hi, I'm Jihan Gabart, like she just said, and I'm Melissa's caregiver. And what that means is on a day-to-day role, I'm very hands-on with everything. You know, I'm the therapist that's not being paid. I'm the therapist that, she just calls on medication management, making sure that she stays on track with work, because at times that's a struggle. And just her daily tasks, and just kind of her wellness provider, somebody that she trusts that she can check in with, and that I always prioritize and make the time to make sure she's doing well.
So we both decided to, I'm sorry, I'm losing have a blank for words right now. Sometimes doing this can be overwhelming. I think that a lot of people see us and think that it's so kind of easy, you guys just do this, but it's difficult because who really wants to sit and kind of bear everything that they're going through? We do this in hopes that other people can get the help they need sooner than I did. Other people, other caregivers can get the support that they need sooner than Jihan did. So, but understand that it's a hard conversation no matter what.
Yeah.
All right, so let's jump into some statistics. It being Black History Month, we decided to look up some information statistic-wise on percentages of Blacks that are getting the care that they need and how we can talk about this conversation and moving it forward. According to the McLean Hospital, Black people are far less likely to seek mental health care. Statistics tell us that about 25% of Black Americans seek mental health treatment compared to 40% of white Americans. Unequal access to healthcare is one major contributor to this disparity. Nearly 10% of Black people in the US do not have health insurance.
So let's talk about that. And let's talk about, how we were raised in our community. So obviously I'm first generation American. My parents are Jamaican. Our parents are Jamaican. Two different families, obviously. And when we were growing up, of course, finances were a big thing. Our parents came to this country and, they worked their tails off to try to make sure that they had a home for us, food, all of the basics. Now, going through certain things at school, growing up, we grew up in Miami Gardens. You go through things and you don't always know how to bring it to the table because it's usually thrown to the side because your parents are so busy, So a lot of times, me and Melissa met when we were 14, and I don't know, I guess we just both came from places that we needed someone to speak to, and we kind of just became that support system for each other, not knowing, where we were growing to. And early on, Melissa would tell me certain things, and being from a Jamaican religious background, when she tried to speak out to her parents or her grandmother, they would just tell her, go pray, go do, go sit down and think about it, go take a nap. And literally they said those things. And it was basically, I chalked it up as I got older and became a parent, became, working in society and trying to pay bills, you see that those are just easier things to say when you really just don't have the time or the finances to really think about this. Like, I'm stressed, I'm going to work all day. You look fine. You look whole, you look healthy. I can't read what's going on in your mind, but it was often pushed to the side where, me and myself and Melissa just became, I don't want to use not a dumping ground, but we just like poured so much into each other. And I don't have mental illness, but obviously I'm a human being. I've gone through some things. And that's how our bond started. We became really close as best friends. And as we went from middle school to high school, we would have certain points where Melissa would do something that's just, and I just say not normal. And when I would say, hey, like, what's going on? We were supposed to be at school at this time. She had a car, I didn't, so she picked me up. And she couldn't explain to me why she was so late, and I'm literally sitting in the house, like my mom is sleeping and I don't want to get in trouble, but I'm like, I may have to run to school, like, just get up and take myself, walk. So by the time she gets there, she's so apprehensive to have this conversation with me, but having OCD, it was a struggle to get out the house. Yeah. Like, she had 4 or 5 rituals before she got out the house to come, and start her day as a child, as a 13, 14-year-old young woman, not knowing that. Yeah. So, we had to unpack that as 2 young girls, and I had to somehow become that trusted person that she can feel that she could offset this on or share this with, knowing that she's not doing something that the average 14, 13-year-old is doing. So that's really how it started. It started in our younger years, and we just had no one else to speak to because no one else had the time. Yeah. And, as 2 young Black girls in a predominantly Black community, area, the teachers didn't have the time, like nobody had the time. Our peers, they were being treated the same way we were, their parents didn't have the time. So, we kind of just rolled with it until, we got to a place and we were like, hey, we got to do something. We got to You know, we have resources. We know how to read. We moved to New York really young and went to college there. So that helped us to gain resources. And, you know, New York City is a different place. They're so much more forward than Miami.
Agreed.
So much more diverse and so much more inclusive with different races, religions, and, you know, so it was just it was just more of an open space for us to talk to different people.
Agreed.
So that's how we're here today.
Yeah, I mean, that's definitely the short of it.
Yeah.
Well, you touched on a lot of good points. I think the first one was the resources. I never realized how important resources were, or lack of resources were, until I got older. When we had this conversation recently, it was like our parents just didn't have the resources.
Right.
And obviously you don't have the time.
Education and resources, sometimes it goes,
100%.
you know, it goes hand in hand.
100%. And these statistics are really important, because why don't we seek the care that we need? Why? Okay, I can't take off of work.
Right.
Okay, obviously it might be something going on with my child, but now I have to take off. Now I have to figure out something else to be able to get my child to this
The
visit.
focus in our community is to make sure, and I know your parents told you that to keep a roof over your head, to keep clothes on your back, to keep food, you know, on the table, you know, running water, necessities,
Agreed.
you know, and that was hard enough, you know, being that opportunity in our community is limited.
Agreed.
You know what I mean? So we're coming from just a limited space where you can, everything is limited. Education is limited. With the schools that we went to, if you will go to a school in another community, public school, they would have just more resources just there. You know, the teachers and the teachers. And I've noticed that because I've had, like my family members that were the same age as me, they would go to school in another district and they would just have so much other free resources than we had in Miami Gardens.
Agreed.
You know, and it was, you know, and it just kind of brought up some points like, wow, you live in a different zip code and it just comes with different things.
Agreed.
You know,
Agreed.
so that also plays a role on your guidance counselor and, you know, just living in a certain neighborhood. You know, it comes with a certain stigma and they keep you in that mold. And they keep you in that mold. So, you know, that was something that we had to break through, and praise God, you know, we did.
And that's why we come and do this, because I think people need to understand that as we celebrate this month, we celebrate how far we've come. But we also have to remember that it's so much more work to be done. And this is a great space to do that work, because in this space, it's everyone. It's not, oh, this person. No, I can line up 10 different type of people, races, classes, and let's give them 5 are gonna have or were affected by some mental illness or someone in their family. So this is a great starting point, because mental illness does not discriminate. So it's a place where we can really do groundwork without necessarily having to have any bias, because the basis is the problem. I can jump to another statistic.
Before you say that, the disparity is also the problem where, you know, I'm a wife, I'm a mother, you know, I'm a working woman, and I was a child at one point. So now my goal and who I want to speak to and who I want to get through to is, of course, who we were when we were 13 and 14, to allow those children to know it's okay to speak to someone. There's so much more resources at this point than it was at that point. And you know, being a mom is also to allow other women to look at a grown, you know, woman with responsibility to say, hey, you have to take out that 5 minutes for your kid. You really have to. You know, my child, I have a 4-year-old and my daughter's almost 2. And it's just those checks and balances every day, just to make sure, you know, like he's developing correctly. Both of them are developing correctly. Speech. How are you feeling today? Jerusalem, you know, mommy had to tell you to stop doing this. And maybe I did raise my voice because, you know, XYZ, explaining certain things to them, that they're not bruised and that they don't go to sleep heavy. Because you go to sleep heavy, you wake up heavy. These children are being formed at this moment, you know? And so just to speak to other moms and other caregivers that are caring for the young, it's very, very, very important how we communicate with these children, you know, that's because they're going to be us.
Yes, that's very true.
Yeah, it's a thing. I look at my kids every day, and sometimes people, I mean, they think I'm crazy, and I don't mind. but this is my legacy. These are my children.
Yes.
I have nieces, nephews, I have neighbors, and all of these children are our future, and they have to feel secure. They have to feel loved. They have to feel like someone cares. And that is all the difference.
Yeah. Yeah.
That is all the difference.
And that also is the groundwork.
Mhm.
When people feel comfortable, they can be able to talk. They
Yeah.
can be able to kind of open up. When people feel uncomfortable, they lock up.
Yeah.
So this work can't be done if people aren't comfortable.
Yeah, we didn't have those relationships with our parents. So we went to school and we looked to those relationships through peers.
Agreed.
Children that are our own age.
Mhm.
Now, what are those children going to do if you do something odd? They're going to tease you.
100%.
So where are you getting support? Like your
Definitely.
parents, your neighbors, your aunts, your uncles, your godparents. It is our responsibility. Every child is going to have something that another child doesn't that could be considered odd.
Yeah.
I was like a giant in school. I'm a very tall woman. So for me, I got teased. And, you had different things. So right. So we can't look to the peers because they're kids also, they may be going through something.
Yeah. Yeah.
So
Yeah. I knew that a lot of people when we were kids growing up had a lot of different issues, but who were they going to talk to?
100%.
All right, so we'll jump into another statistic. Only 33% of Black Americans with a mental illness sought help from mental health services in 2019, while 50% of white Americans did. Mental illness related stigma, lack of trust in the healthcare system, lack of ethnic and racial diversity among providers,
Mhm.
and lack of insurance or underinsured are just a few factors contributing to this disparity. But there are numerous now organizations that can help. History of mistreatment, such as U.S. Public Health Service syphilis study at Tuskegee, as well as existing socio-economic and healthcare inequities are among the factors contributing to this mistrust.
Right.
That's coming from everydayhealth.com. Those are just some facts about how many of us feel within our community when we do
Across the board.
100%.
Not being able to and have providers, and there's no trust because there's the disparity between the races are just so far.
Agreed.
And not being able to. So just a short story. Like when I was having my first child, I work in the medical field, but I work in the technical part of it. So I'm always in hospitals. So I gained a lot of knowledge just through being, on the field, like in the hospitals, but not necessarily being a nurse or a doctor. And there were so many things that I knew were going wrong with my delivery. And my doctor was just so dismissive of me until I had to like leave AMA, and then come back. And he actually tried to cut me from his care at, what was I, 39 weeks? Like he actually tried to tell me, I'm not delivering your baby, but that's illegal. He couldn't do it. So I wound up going back. But it was just how he dismissed me, and I have other girlfriends that have told me similar stories, being a woman of color, going to a hospital, and they just expect to tell you what to do, not explain to you what's going on. And then they just assume you don't know what's going on. Like I know how to read my strip, like when my baby's heart was decelling, I knew all that. And he tried to hide it from me where I'm like, no, something is going wrong. Speak to me, talk to me as if I'm a human being. And just through those conversations, then it gets awkward. This is your healthcare provider. This is the person that's going to deliver your child. It just becomes a thing where it's like, if I was of a different race, would we be going back and forth? You know what I mean? Like it just, I don't know, it just brings up so many things, not just in the mental health community,
Agreed.
just across the board with healthcare.
You're right.
And that causes mental illness. And my birth was such a traumatic birth with my son. And I don't want any more kids. Well, I had my daughter, but I even had a thing mentally, like going into the hospital when I had her, because I had such a horrible birth. And these things, people don't understand that your brain is made of just chemicals, so once you're thrown into shock, and those things leave memory, and that's what is PTSD, and that can develop into a mental health condition. So it's like one feeds the other. And us being thrown into these situations as people of color, it just, people don't understand what it does to us, even if we came into this world with everything we needed here, just the struggle of every day. And you're looking at another race or, another person that you try to explain that to them and they have no idea what you're talking about because that's not their experience.
Agreed. Yeah.
It's
difficult. I think that if we can all look at our stories as just a story and take everything out, we'd be surprised how much we're alike. How much somebody else can say, oh, wow, I went through that. You know what? My aunt went through that. My mom told me that story. Or I saw my uncle going through some things. But I think when we begin that conversation with what we're looking at, it's always going to go wrong. Yeah. It's always going to go wrong because we don't know.
And unfortunately, you see a person before you meet a person.
100%.
So that judgment already comes. And the country that we live in, 9 times out of 10, you're judged by your skin complexion.
You are. And I think that that's why it's important to have these conversations, because we have to talk about where we've been, where we are, and where we're going.
And how it affects us mentally.
It
does.
It does. And it has.
Mm-hmm.
I'm not sure if, I think that me having mental illness was already difficult. I love who I am. I love my culture. I love where I'm from. So for me, I never thought I had to factor that in. I always felt like whatever I needed, I needed to try to find a way to get it. But through my journey, as far as my mental illness and having to go to different providers and having to speak to different people, I also realized that it's also a class thing as well. So we definitely talk about race, and that's one part, but it's also a class level issue as well. When you're in a certain socioeconomic status, people can either, one, dismiss it, because if Jeff Bezos goes to a psychiatrist, he'll probably say, what kind of problem do you have? You're the richest man in the world, not even in your own country. And then if you might be down on your luck, somebody might be homeless, they're gonna just automatically assume that you already have a mental illness, when sometimes that's not the case. So this is such a multi-level layered conversation, because within our country, it's a lot of different reasons why people judge.
100%.
And it depends on what side you're on. I've been at the doctor before, and I'm coming in self-pay. I didn't have any insurance at the time, and he basically dismissed me. Right? I'm like, just because I have this money to pay you doesn't mean that I don't need help. And I'm basically begging this doctor to help me. And he's like, well, I can give you some Xanax. I'm like, I don't need that. I need someone to listen to me and help me. But he's just like, what do you do for a living? I think you're fine. And I came home and I told you that experience. And that was my first time being like, okay. And then I go to the community clinic, and I'm just waiting there, and I'm waiting there, and I'm waiting there. And when I finally get there, this doctor doesn't even look up at me. It's like, here's your refill. So it's so much overhaul, I think, that we need in this country when we talk about mental health and mental illness in general.
So I want to ask you a question. So in the news, there's so much going on, not too current, but when a person is in a manic episode, or like going through an episode, and the police has to intervene. How comfortable do you feel seeing all that has gone on, being a woman of color, and if something goes on with you, and I would have to call the police because I don't know how to troubleshoot at that point? How, like, looking into that, how would you feel? Would you feel protected? Would you want me to call the police? Like, what would you want me to do?
That's a good question. If anyone has questions, please go ahead and type them in there as well. Let us know. That's a good question. I'm not gonna lie. I would feel very uncomfortable.
Right.
I would be very leery about it in general. I say, hey, just drop me to the hospital. Just drop me to the hospital. Leave me outside the emergency room. I'll figure it out before you really have to go that far.
But there's been times that you've been in situations where you're not You
Yes.
haven't been open to say, hey, let's go to the hospital. I don't
Yeah.
need to go to the
Yes,
hospital.
very true.
Where defense meets me first,
Very true.
personally.
Very true, yes.
You know, and how would we troubleshoot that?
That's a good question. I mean, it's been times where, just to be honest, just so we could be able to really have this comfortable space where I looked at you like, you should have called, you should have called, you know, like, listen, you should have called them. You should have, because I needed help at that moment.
Right.
But I see why you were afraid.
Of course, because look at what happens to people, you know, on the phone, on the 911 call. There's been instances where you disclose this is a mental matter. Like this person
100%.
is not good. So
Yeah.
when you come, just understand that this person, you know, may be screaming at you, may have a bat, you know, but don't take it anyway. Like this person is not a violent person. They're just in an episode right now.
Mhm.
And it still goes wrong.
Yeah.
People still, you know, like the person that called, the caregiver that called, still, the person still winds up dead.
Yeah, that actually happened in Miami Gardens in
Right.
2016. Laval Hall, his mother called the police. He was in the episode. He is diagnosed schizophrenic, and he was wielding a metal broom. And his mother told the police what was happening. She just needed some assistance, and they shot her son and killed her son.
Exactly.
And after that, she said that she wished she never called the police.
100%. Because again, what were her resources? And how long did she know that her son had this mental illness, and how long has she been dealing with it? Did she have help? Did she have resources to understand how to troubleshoot it where she didn't have to call the police? And then when you call the police, who are supposed to be the people that help, he had a broom. A gun and a broom, there's no match.
No.
You know, so for those instances in our community, that's another reason why, you know, spreading the word and having these conversations, we need to share as much resources and as much knowledge that we have on how to troubleshoot a person when they're going through mania, or, you know, when they're going through any type of episode, so that we can try to keep this person alive, is what I'm really trying to say. Because sometimes those law enforcement officers are looking at this person as a threat. And there's been instances when that person was not a Black person. It was a white person, and they walked out of there with their life.
Agreed.
You know, they took them to a mental institution. They did what they needed to do, you know, but a lot of times when it's a Black person, that person leaves hurt, you know, they leave like handcuffed, they leave abused, where that wasn't what it called for. This wasn't a call because this person is a criminal and they're trying to, you know, rob me, or they're trying to hurt me. This person needs help, and I just don't know how to do it.
Yeah.
And I don't have another number to call.
Yeah.
There's no emergency line for mental illness.
Not here. In other states, they've gotten with it. I think other states have gotten with it. I really hope that Miami is the next one.
Yeah.
And yes, we do. They did mention that they do have 988.
Okay.
That's a phone number to call if someone needs assistance.
Amen.
I think that you're mentioning literally a mental health task force.
Yeah.
Probably.
Well, at that point,
that
somebody is you know, like in that situation, would that have been a force to come and pick that person up immediately?
I believe that 988 number is probably more that will lead you to the help, to getting that help, versus before where it was just 911.
Okay.
But just to know, you're right though. It's some cities here in America that has a full mental health task force. These are police, but they're trained.
Yes.
They're trained to go out and manage mental health situations, so they understand how to manage them from the beginning. So I think that's a little different. So I understand what you mean in general, but
thank you for that. I didn't know that they had 988.
Yeah.
And it's just a diversity, you know, it's just these law enforcement officers to understand that they're every time you come into a situation and the law enforcement officer, the police officer shows up, you're going to be dealing with somebody that you don't know. They could be of a different religion, you know, a different mental status, whatever. And a lot of these officers are just not trained to deal with anyone outside of
a criminal.
And
that's what
right. You know what I mean? And that criminal to them, you know, may look a certain way.
Yeah.
You know,
that's what we need. That's what we need. We need those task force, and people say certain things like, hey,
training,
you know what?
Training.
We need that training.
Yeah.
Everyone in general, I believe, should have that training, but we also need that task force to say, hey, you know what? This person says they have thoughts running through their mind, certain key words that you can catch to say, hey,
because I mean, think about it, as a mother, you know, and me only being a mother for 4 years, I am terrified of, and it's just a mental, it's just the effect that all of these things in the news with these young Black men have on me as a mother to a Black child. Like, it has totally changed me. My children don't leave the house unless they have to, you know, unless we're going somewhere specific, but like to go to Publix or to go to Walgreens or to go anywhere, you never know what's gonna happen. Like, my baby is I'm tall. My son, he's 4 years old and he looks 7. You know, so if he picks up some candy off the shelf and thinks it's okay to eat it in the store and he's perceived as something else, like, these are the thoughts that run through my head in 2024. You know what I mean? When I grew up in the 90s, nobody thought about that. We went to Publix, we went to Walgreens.
We did anything.
We did anything. You know, we had a childhood, and, you know, as a race of people, we had a good time. And our parents didn't have this burden on them. And I feel so burdened. I feel that my mental health has been impacted by society and all of these cases that have been coming up. And it's super sad, because I wasn't born with a mental illness, but I do feel like now I struggle with different things because of what I see other people go through, and what I see other parents go through. You know, I don't ever feel like I'm exempt from any situation. I'm a mom, you're a mom. You know, we just always pray that it's not us, and I pray that it's not them, but it's gonna be somebody.
Yeah, I agree.
You know?
I agree. And I think that we need to take this time to always be able to have these vulnerable moments, because this is the only way we know what's on our minds. And every community has their own story. We have our college roommate who's Indian. She has a whole other story that we had to be introduced to, like, wow, okay, this is very different from the way we would view a situation. But this is how you guys within that community handle it. So every community needs to be having this conversation.
100%.
We have Hispanic friends that have their conversation. We're like, oh, wow, this is how you guys would view this one? Well, this is how. So the first place is your own vulnerability. The Asian community, every community has to get together and have an honest conversation about what they deal with. And then when you're comfortable, we can continue to share. And that's where we can be able to grow and learn and not be afraid and not have these kind of thoughts and different thinking different things, when we all talk first honestly. So we just wanted to start this within this month, a candid conversation. And thank you so much for being open, because I think sometimes people look to the person with the mental illness, but it affects everyone. Because you sound like you're describing an anxiety.
I have so much anxiety.
You know, so that just shows that this is for everyone. We need not 2-3 billion people to be on this Zoom call right now, because it's everyone that can relate to some piece of this conversation that we're having. I see the chat blowing up, so I don't want us to keep going. Let's see what questions you guys have.
We have a couple of questions, and I want to thank you both for sharing your story and also those educational statistics. You know, that is something that we do here at NAMI. We support, educate, and advocate for mental health. So it's great that you were able to share that and be vulnerable and have this conversation. There has been some resources that have been put into the chat as well. Like it was mentioned, the mobile response unit information is in there as well. And we do have a couple of questions. First one, what are some of the differences you experienced in New York versus Miami regarding mental health care?
That's a good question. So quickly, in New York, my mental health was not good at all. People, you know, they like this new overstimulated word I see thrown around online and on social media. It's a real thing. And for me, New York wasn't good for my mental health. It was too many moving parts. I didn't seek help when I was in New York. I should have, but I just tried to manage, and it was probably the worst.
Because there were groups.
100%.
There
New
were
York is
a
so
lot
much
of
more advanced in that, but
like even in college, there were just people just got together. You know, New York has a way of if you're a part of a mental health group, it's just so much easier to find. Like there were resources at school, like something like NAMI is everywhere, nonprofit. You know, we used to do book drives when we were younger. There was just a place for us to just go and donate books to children. And it was just everywhere, you know, everywhere you looked, you know, and keep in mind, this was at a time where we're grown-ups. We were there during 9/11. So the city was rampant, you know, it was just so much going on. So there were so many resources for that purpose also, because people had lost so many family members. These children lost both parents in 9/11, you know, so those resources the resources came about, I'm sure, heavily because of that. And then, you know, it just being New York and being a more forward city.
I agree. But no, to answer your question, my full experience with my mental health care is here in South Florida, because I wish I would have, but I did not seek the help that I needed when I was living in New York.
Yeah, and it was worse. It was worse when you were in New York.
It was bad.
You were.
And I can laugh about it because I made it, right? And that's what sometimes we just have to pat ourselves on the back and say we made it. We made it. We're still here. But no, I didn't. I wish I would have, because I definitely would have been further.
You would have.
I would have. Yeah. Good question though.
We're gonna go to, I see some hands raised, so I'm gonna kind of go back and forth through the chat. Shara, I see you have a question, your hand's raised.
I don't have a question, and again, welcome everyone. And listening to their stories, normally I always start a conversation with my background and my role in NAMI, and I didn't this time because of the timing. So I wanted to share with everyone, I am NAMI's Black and Underserved Outreach Coordinator. The conversation that the ladies are having today, that was the purpose of NAMI Miami having a Black and underserved community. NAMI knew it was essential to have a position to hire someone from the community. And when I say I'm from the community, I lived in Miami Gardens. I went to school in Liberty City, finished from Northwestern. I attend church in Overtown. I am Miami. I am that person. More importantly, I was a Dade County Public Schools teacher for nearly 20 years. I resigned after I lost my father and I went into a mental health crisis. I understand their stories. I understand how unsafe and uncomfortable it was to find resources. We just had this conversation the other day with the Florida Department of Health with accessing care. I'm going to fast forward because I don't want to take up too much time. Our Black and Underserved Communities Initiative, we work now closely with clergy throughout the county. It's not limited to any denomination. We are here to bring awareness. We want to break the silence, and we want to talk about the resources. I heard you guys mention about the police. I'm working now closer with Commander Baker in the Overtown community, but not just in that community. NAMI works with Miami-Dade County and law enforcement to train officers on how to deal with mental health crisis. I learned only about 988 and the resources because I work in NAMI, but I'm a person with lived experience. So I take this position very personally. We're in Dade County Public Schools. We're doing things that all of my years in teaching never happened. Not that the counselors didn't want to, not that the parents didn't want to. It's too many factors to say one thing was the reason why this didn't happen or that didn't happen. But in listening to the conversation in our communities, we have to have that sharing hope conversation. And I'm going to end with that. Sharing Hope is a resource that NAMI National offers, where people from that culture, you sit and you have the exact same type of conversation we're having now with people in your communities. So they have one for the Hispanics, the Asian communities. We're also working with national office so we can have one in Haitian Creole. Everything that you all are saying, I want you to continue to fight and know that you're not alone. You two don't even know, but you just signed yourself up for NAMI's Black Advisory Committee. And I've already shared that with Melissa, but I'm going to say it publicly in front of everyone. And our board director, Susan Rachel, she's also on the call and she was answering a lot of the questions. I don't want to take up everyone's time. Oh my God, this is so personal and so empowering because you're not alone. That's another message I want everyone to know. You're not alone. There are resources, but I need everyone's help with jumping aboard and spreading the word. It's a lot of work to do. No one could do it alone, but we're breaking the stigma. It starts in ourselves. It starts in our household. And NAMI is one of those resources that you should and can utilize. So I'm going to stop because I could talk forever. If you really know me, I can talk. So I'm going to be quiet. I'm excited now. I'm excited. Sorry. Thank you.
Thank you so much, Shura. I'm gonna go, there's someone, Robina, I see a hand raised. You wanna ask your question?
Yes, I want to commend these two young ladies. I love the way you shared your story, and I really commend Jihan for choosing to help her friend. Melissa is so blessed. I'm someone with lived experience. I work for NAMI Broward as a peer mentor and a support group facilitator. And as a matter of fact, next week, I'm going to talk to the crisis intervention team. We're going to share some of our stories. I'm curious because I've always had mental health issues. And when I got to college, I did try to reach out. These ladies looked a lot younger than me, and they said that, so I came on a little late. So I'm assuming you all went to school in New York. Was NAMI on your campus? Were there mental health resources on your campus? Was it readily available?
So we went to college in New York, went to high school here. There were groups that I remember, but again, when Melissa was in New York City, so how it goes with mental illness is it matures by 25, 26 in women. That's when it becomes it. So she was moving into a space like, we spoke about this the other day, where in her teens, it was OCD. OCD was something that she battled with. Now, bipolar was coming, but that didn't fully become a mental illness diagnosis until she was about 23, 24. And at that point, we had already, made our way out of the university. And now we're still in New York, still navigating, still working. And at this point, she's drowning.
Yeah.
Right. So and she's not open to realize that she now may have something else that she's battling with. So this was a process for Melissa that I was just, I was just happy that we are so close and that we were able to do this journey to move to New York City. Because had I not been there, and being the type of friend that I am, I'm her friend first. Before anything, we're best friends. I'm her caregiver because, again, I was thrown into that role by just being so close to her. And I was just so grateful to be there with her because it was just so many different scenarios and moods and different spaces. I don't know if you know anything about bipolar, but she experienced most of them, in those younger years in New York City, which is not, the safest city.
No,
and then she wasn't open with herself or ready for us to have a serious conversation about, sis, something else is going on. So if I did say it, it would be an argument. It would be combative. It would be defensive. I never gave up because I know my friend and I know something was going on, but she was not open to getting that help there.
So to answer your question, Rubina, I never looked. And I say this with a smile because I can't even imagine not feeling that way about myself to try to get that help. But people don't understand. You bury that.
Or give yourself more grace because you're used to just having OCD and you weren't even diagnosed at the time.
I wasn't.
So give yourself grace that you're now taking on a new feeling.
Yeah.
So, we all trust our mind.
Yeah.
We do. We're us, we're people.
Yeah.
So for you to take my opinion, that's not easy.
No, and it wasn't.
And that's what I'm saying.
Yeah.
So give yourself a little grace where you could have taken it more serious. But, in the same token, I mean, it's not an easy thing for somebody to come and tell you something is wrong with you. You're doing this weird when you're doing exactly what your mind is telling you to do, and you're feeling like you're normal.
100%. And
Because
going about these
right,
things
you're
in
going off of your own
conventional way.
mind. You're going off of what your body and your mind, your self-talk tells you to do.
Yeah, that's true. It's true.
So
Yeah, I mean, I think that's another thing. Obviously, we can have this conversation
it's a process.
for months, and it's a process. But I think you said it best. Anyone on this call who has a mental illness, give yourself some grace. Give yourself some grace.
Give yourself some grace, but also be
yourself some
very,
grace.
very, very open to outside opinions, because I saw things that Melissa couldn't see because it's normal to her. People don't understand when we say people are wired different. It's true. It's
Yeah.
true. People are wired differently, and they see it just the same way we see it. They see it as this is, well, let's walk across the street on a red light. Some people see a green light and walk, but that's normal to them. So, you know, it's good to take outside opinions, but we also have to give that person grace to understand that they're having to trust someone fully to tell them what to do as a grown-up. Like, that's not easy.
It's not. It's still not.
Yeah.
Still not.
Thank you.
So I see Susan Rachel, our board chair, has her hand up.
Thank you. And oh gosh, thank you for this wonderful, wonderful sharing. I just wanted to let you know that there are resources in the community that whether you have insurance, you don't have insurance, you don't have enough insurance, you know, in addition to the NAMI resources, there's an organization called Thriving Minds South Florida that is funded by the state of Florida to provide mental health and substance use treatment services for our community. No questions asked, documented, undocumented, insurance, no insurance. So please, you know, understand that there are resources in the community. Thriving Mind actually has set up those 4 mobile response units. You don't need to call the police. The police are better trained than they've ever been, and they're starting to embed social workers in their mental health response calls. But there are 4 mobile response units for Miami-Dade, North, South, East, and West. And they will talk with you on the phone. They will come to your house. They will come to your office. They will come to your child's school. So please know that these resources are really there. And finally, I just want to say, you know, yesterday was Valentine's Day, but your love story of friendship means more than anything that I could have personally experienced. You are just beautiful people, and I thank you for being with us tonight.
Thank you. Thank you. Thank you so much. Thank you for the information too. Yeah.
So I see a few more questions in the chat, and I definitely want to get to them because I know that we want to be mindful of everyone's time. So the question is, do you recommend any women or co-ed circles in person to continue these discussions?
That's a good question. I think that's what we're building. So SoMypolar, that's what we're building. I think people say, oh, you know, I want to sit at the table. You don't have to have a seat at somebody else's table. You can always sit with us. So that's kind of our motto. So visit our website, SoMypolar.org, follow us on social media, because that's what we're creating. Definitely, we speak from 2 very strong perspectives: a person with mental illness and a caregiver. These two people in a room, it can go a lot of different ways, because Jihan, as a caregiver, is also a parent for some people, is a spouse for some people, and can sit with them and talk with them and cry with them and understand so many different things that they don't even talk to anyone else about.
Yeah.
And me, as someone with mental illness, can sit in a room with that person that's struggling, that's wondering why are they even here, and can talk them through those kind of things and let them know how I continue. So we're creating that space right now. We want women, we want men, we want more people to join, because just like Shahara said, we have to get louder. We have to get louder. We need 21,000 of these going on every night somewhere in this country, in the world, because
Yeah.
this is the only way that we can be heard
Mhm.
as one when we're all
Right.
talking.
There's not very many groups, and we found a couple on social media, and of course we're a part of it. We share, you know, we follow them, they follow us. We go for tips, and you know, just to be a part of a community where sometimes I'm a part. You know, I follow a couple caregiver feeds, and it just talks to me sometimes. You know, but to have an actual group, we're actually trying to do that now because that's what we're lacking. You know.
Yeah, and obviously it's amazing organizations out there, but we're talking about grassroots people to come tell us your story, tell us your perspective. We want to support you. What do you need to get the support that you need? What do I need? Because we all still need support in different ways, you
100%.
know? So it's so many support groups. Throw them in there. I see some people putting them on there, but that's what we're really here to create.
Yeah.
So this next question, I believe it is the last question in the chat. And if there's any more questions, please feel free to add them. And this one's for Jihan. As a caretaker, what do you do to take good care of yourself?
I get that question so much. So recently, and that's just recently, like I said, I became a mother. I got married a couple of years ago. And I finally hit a place where I was like, what are you doing? Like, what are you doing? Like, you just keep on going. And I had to sit down and start like literally taking things in. And I think a part of, things that I went through as a child, I've always been the type of person to put things to the side and just keep it moving. You know, that's a part of my culture and my family. And that wasn't serving me. So now, prayer is number one. I pray out loud. I talk. You'll think someone's right beside me. They're not, in spirit, yes. I take a lot of walks by myself. I separate myself from my spouse and from my children, and I take long showers. I prioritize myself differently now. And because sometimes it gets so heavy. It gets so heavy, and I try to place, my problems to the side to sometimes deal with my best friends. But you hold that, like it's her problem, yes, but you still feel that, like how, and you try to work through those emotions that she's having, and obviously you can't, and you can help as much as you can help, but my best friend still feels like, why her? Why was she given this?
Yeah.
And I just recently, within the last couple of years, just decided to start separating myself and prioritizing me and doing a lot of things alone. For a long time, a lot of people probably wouldn't believe this, but I never told a soul about what me and Melissa were going through. I held every bit of it in, every bit, because number one, she's my girlfriend, she's my best friend. So her not being comfortable with her mental illness and me speaking to another friend about it, me speaking to my mom about it, because she's close with my mom also, that felt like betrayal. So again, I was carrying that. And it was a mess. I have a therapist. I go to therapy. And it's not because of this, but it's just self-care for me. I'm a human being also, apart from being a caregiver. And, I don't speak to a lot of my friends and, my siblings or people in my life about personal things. So God and therapy is like it. And of course, Melissa's a support system for me. She is. She does her thing. So.
And I want to also bring that up for the people with mental illness. We still are friends. We
Good
still
friends.
are spouses. I want people to know that you can divide this thing up. Yes, it does affect who we are, but we still are so many things. I think sometimes we just need to push. Sometimes we have to push through that.
And remember that you're a person. You're not bipolar. That's a part, that's something that cycles.
100%. That's a diagnosis. Like
exactly, it's a diagnosis. Like you're not diabetes.
Right.
You're still a person.
100%.
So.
That's great. Yes. Shara, I see that you have your hand raised.
Yes, as long as no one else, because I didn't want to interrupt.
No, there's no more questions in the chat. So
okay. She kind of answered it a moment ago. I was going to asked about how does she manage when she sees that she may be going through an episode. Um, for example, for me, and I'm happy to see some of our clergy and Black Advisory Committee members on here. For me, it was initially everything was go to the Bible, and I still do. That is first and foremost for me, and prayers. But in addition, even clergy will tell you still take care of yourself. So how do you manage your faith and your mental health, and what are some things that you may do to help you during some hard times?
That's a great question. I don't think I've ever had that question. And that's so personal for me. My faith is so important. I think that it's been times where it's just like, nobody could tell me this is fair. Nobody could tell me this is fair. No one can tell me that this makes sense. Someone somewhere just wants me to not. But it's been times, like you said, Shar, I have to go to prayer. I have to go to the Bible. I ask Jihan to pray with me, send me scriptures. But also within that kind of held me back for a long time, because I felt like, well, why am I not healed? Do I not believe enough? So the Bible says if you have faith the size of a mustard seed, and it's just like, I think I believe, so why I'm still, I would have those things. And sometimes I would become upset. I'd be mad, like, I pray, like, I'm really thinking, I'm trying here. Why am I not being delivered from this? But I finally understood one day,
Look,
like,
you're a vessel.
yeah, I had to kind of separate that out. Like, Melissa, this is what God has given you, so use it. And that's where SoMypolar was born. Where it's like, you know what? This is it. I'm tired of saying, oh, girl, I'm not bipolar. I was just hungry. I'm tired of doing that. I have received my diagnosis, and it's the truth, and that's okay.
Yeah.
And we can do this. I can do this.
And look how you manage it.
And
you have
100%.
You have your own business.
Yes.
You're thriving
Yeah.
against all odds and what the average person with 3 different diagnoses.
Yeah.
You know what I
Yeah.
mean? You're not on government assistance.
Yeah.
You're really, really smashing it.
Yeah.
Like, you're doing exactly what you weren't supposed to do. So,
yeah.
Glory to God.
Yeah,
Like,
glory to God. And
there you
I've
go.
been there. I've
Yeah.
been on that government assistance. I've been in all of those spaces. And I just told myself, we have to keep trying. We have to keep pushing. And when I finally received this mental illness within my religion, within my faith, I say, Melissa, take it as a blessing. Let's see what we can do with it.
And now look at you.
And now
People are looking up to you everywhere.
Yeah, and I'm grateful. I'm grateful, and I look up to people everywhere. So
Amen.
good. Amen. Yeah.
That's great. I am so grateful that we were able to have this speaker meeting this month, and everything that you have shared has been great. We want to thank you again so much for joining us, everyone who has taken time out of their evening to be here and be a part of this conversation. In the chat, we have added some events that we are going to be having and some of our programs that we are going to be starting up soon in this month, such as our peer-to-peer educational program that starts on the 24th of February. We have our mental health awareness walk, our walk for mental health awareness on May 18th at the zoo. We would love to see all of you there and walk for mental health. And again, we want to thank Melissa and Jihan for both being here with SoMypolar. Thank you both so much again. And we hope that everyone has a great evening. And if you have any questions, I don't know if you ladies want to put your email. So if anyone has any other questions, they can reach out to you, or any information on SoMypolar INC. That'd be great to add in the chat as we wrap up. Awesome. Thank you so much. Again, thank you everyone for being here, and we hope that you have a great evening.
Thank you, and good night, everyone.
Thanks for having us.